Thank you, Jamie. Good evening, everybody. My name is Michelle, as Jamie pointed out there. I'm a Business Development Officer here in Perth. Joining me tonight is also my colleague Chow, who's here in Perth. And we'd just like
Good
to thank
evening.
WAPA. Thank you, Chow. We'd just like to thank WAPA for the opportunity to present to you all this evening on PRODA, HPOS, and using the AIR site. So, tonight is basically about providing you with some practical tips to assist with registering for PRODA and using the AIR. So, I'm going to start with the PRODA and creating an individual PRODA account and how to access the AIR site via HPOS, and then also just show you how you can use HPOS messages, which is a secure encrypted message facility available to you once you've got access to the AIR. And then on the AIR site, we're going to look at how you can report some immunisations. We'll look at the history statement, and also we'll touch on data quality. And then at the end, we're going to have a run through of the education resources that we have available on our website, because we have some simulations and some infographics and education modules that you can actually run through in your own time on most of the topics. Okay, so just a quick introduction to the AIR for anyone here today who is not familiar. So the AIR is the Australian Immunisation Register, and it's the national register that records the details of vaccinations given to individuals of all ages in Australia and overseas, both historical and current. So we collect this information even for people that aren't eligible for a Medicare card. And it is now pretty much mandatory to report most vaccines administered in Australia to the AIR. There are very few that actually fall outside of that legislative requirement. So to access the AIR, you must be an approved vaccination provider. For a health professional, that would be like a GP or a nurse practitioner. Their access will be through their own Medicare provider number. For an organisation such as an aged care facility, there are a series of steps that you will need to go through in order to be recognised as an AIR provider and have access to the AIR. So, firstly, you would need to apply for an immunisation provider number, which is that form that's just popped up there, the IM004 form. Once completed, that gets sent through to your local state health department, and they'll go through the necessary checks, and then they'll approve, and they send it through to AIR for the AIR to actually process the application. Once that's done, then we will send out an AIR provider number and an AIR linking code, which is needed to actually link AIR to the PRODA organisation. And that would obviously be done by perhaps the owner of the facility, or it could be the facility manager. But again, they still must start with an individual PRODA account. So everyone must start with an individual PRODA account. So then the PRODA setup happens. You've got your AIR provider number. The director, as I mentioned, or the business owner creates that, links AIR to HPOS, adds the members that are going to be part of the organisation so that they can access the AIR. That could be administrative staff, could be nurses, anyone that actually works there in the facility that would require access to the AIR. And then you get the access. So we're going to do this shortly, but access to the AIR through My Programs. Behind that is the program tile for the AIR. And there's the welcome page to the actual register itself. So in order to create your individual PRODA account, what you will do is you will go to the Services Australia website, the address up there, .gov.au/PRODA, and you will actually be able to log on and or create your individual account if you haven't actually got one. So what is PRODA? PRODA is the online identity verification and authentication system, and it's what lets you securely access government online services. So it's not just the AIR through HPOS. There are other programs that can also be added, but of course, tonight we're all about the accessing the AIR. Well, I am at least. All right, so we go to PRODA up the top there, and then onto the logon screen. So what we always suggest you do if you're going to go and create your individual PRODA account is you make sure you've got your identification with you. So you only need to input the actual reference numbers for those, your passport, your driver's license numbers. Don't need to actually have them copied or certified or anything and send them off to us. You'll actually be able to input them into our online PRODA logon, and we will verify in the background all of the details. So once that happens, you'll be issued with a PRODA RA, registered authority number. Now that belongs to you. That's your own individual PRODA account. So whilst you might work for an organisation and they give you access to the AIR for that organisation, should you leave, that's yours. You take that with you to the next organisation that you work at. They would no doubt end your access to their organisation, but you will keep your own PRODA account. Okay, so, and we always suggest that you do use, when you set it up, which I'm about to show you, your own personal email address in the instance, of course, as we mentioned, that you do change positions and no longer have access to the email account with your employer. Now, just one more step before we go to the demonstration. There are people, of course, that may not have a passport, driver's license, Medicare card that all match up nicely, and therefore you may need to use the backup plan, which is by being prompted to complete this manual identity verification. It could be something doesn't match. If your surname on one identity is different to the surname on another, things like that. If they're not all verifiable and you don't have an instrument that explains that change, then you will get a message and you'll be asked to complete the manual form. By all means, you can call our PRODA help desk though, and they may be able to advise you. Perhaps there's a different way you could go about it, but we will still more than likely be able to get you registered, even though, as I say, you may not have the standard 3 documents that we usually have for people. Okay, so without further ado, I am now going to go and share my screen. And what we're going to do is, firstly, I'm just going to go to our website and show you, if this was what you were going to do as soon as this session ends this evening and go on and create your PRODA account, you would go to the Services Australia website, up here, MyGov, which you may have as well, and then down here, scroll, PRODA, Provider digital access, scroll down, you can see there are some outages here. If you go to do this and you see an outage for birth, deaths and marriages or the Australian Passport Office, you probably won't be able to do it. But as you can see, none of those are those, so we're in luck. Tells you what browsers it's compatible with, so just make sure that you are using one of the ones that it'll work nicely with, and then you click log on. And this is where, if you already had a PRODA account, you would put in your logon details, but we don't have one, so we would register now. So that's where you would go if you're going to do this later. I obviously can't create in the real world, so I'm going to what's called our test site, and I'm going to register now. It'll be mostly the same as it will look for you when you were going to do it. So I've got my documents and I'm ready to go. So let's register. All right. So obviously step 1, my details. So just pop in all your details. Choose whichever gender is applicable, your date of birth, and next. So we want you now to create a username. Now, that's purely whatever you would like it to be. Obviously, it can't be anything that would be deemed offensive. And also, it is something that you can't ever change. So bear that in mind, just stuck with it. So obviously, you want to choose something that's going to be with you forever, so to speak. So say it's Carlton, just for an example. I often like to get my football team involved. Okay, and your password. Like a lot of things, 10 characters, uppercase, lowercase, and one special character. This can be changed and can be reset should you forget it, because of course it is always possible that that could occur. So pop in a password that meets all those requirements, and I forgot one, so I'm just going back to fix that. And then next. All right. Now, this is the means by which you would identify yourself or reset your password if you needed to. So this is the security questions. So these are predetermined. So you'll have to choose like the name of your first pet, the street you lived on, etc. So we'll go there. And second question, model of the car. This isn't true, but we can all dream. And then favorite hobby. There we go. So if I was to ring up and I needed to verify myself, then I would need to remember these answers. Okay, now we want your email address, and this is going to be the first thing that you verify with us. Now I need to put in a special one so that I get the verification. So just bear me while I pop that in, but this would be your personal email address. And what we do is we send you an email to verify that email address. It's quite a long-winded one, of course, because I've got to put in those extra informations. And next. Okay, so they've sent me an email with my code. I'm just coming over to grab it. And this is what it looks like. So I have my PRODA verification code. There it is there, 014813. So I'll just pop that in, 014813. And next. Okay. So we've completed successfully step 1. And now next. And this is where you pop in the details of your identification. So I'm going to go with the passport. Next. It automatically puts in my details for me, so it saves you a little bit of keying. Then you just pop in your passport number. And next. Okay, your Australian passport has passed online document verification. That's brilliant. Now I'm going to do my Medicare card. And next. Again, pops in all those information there. I'm just going to pop in my Medicare number now. And the individual reference number, often you'll see that abbreviated to IRN. It's just the number in front of your name on the card. And if you're an Australian resident citizen, it'll be a green card, so we'll leave that like that. And then the expiry date on said card. And next. Okay, so now my Medicare card has passed online documentation. So this, even though of course this isn't the actual real PRODA log-on account or we're creating it, it's pretty much mine when I did my real PRODA account. It took me 7 minutes, and quite honestly, the time that it took, reason it took 7 minutes was, trying to think of the username. All right, my WA driver's license. Okay. And then the card or number on the back. I'm just going to bring up the image. Obviously, this is our test site, so that's why I get the help with all of the identification. You'll obviously be popping in yours. Okay, and next. All right, 2 ticks, brilliant. I've verified my account and I've verified my documents. So now I need to match existing services. So even a doctor or a nurse practitioner, anyone that wants to access AIR will need to match existing services. So if you click next here, you need to tell us your verification code preference. If you're able to use a mobile phone in the workplace, by all means choose mobile phone. If not, leave it as email and click next, and it will send a verification code to you. That means because every time you log on, you need to just have that extra security of a code, much like, when you log on to your bank account and things like that. So what we want to do is we need to link HPOS to our PRODA account. Okay, so we've got a PRODA account, but because we want to access the AIR, it's through Health Professional Online Services. So we're going to click on HPOS. Okay, so this is where, if you were, for example, a nurse practitioner with your own Medicare number or a doctor, you would say, yes, I have been issued with identifiers. I haven't in this instance, so I'm going to say no. Am I a responsible officer or organisation maintenance officer for an e-health organisation? You may be, you may not. You may never have heard of any of that. So again, no. But what we've done now, you can see, is we have successfully linked HPOS. Okay, so it's telling us you've successfully added to your account. Congratulations. You can now use your PRODA account to access your services. So that is how to create a PRODA account. Didn't take too long, and I'll just show you here as well. I got an email, and there my username has been sent to me and my registration authority. Good idea to keep that. Not imperative, but obviously you do need to give that to whomever is going to add you to the PRODA organisation so that you can have access to the AIR. Because at the moment, as an individual without any linked identifiers of your own, whilst you've got PRODA and you can go to HPOS, you haven't got access to the AIR. Okay, so we will resume now with the presentation. Apologies, just a bit of a delay. Okay, so that was creating an individual PRODA account. All right, and we went through these steps that we logged on and we linked HPOS so that we would be able to log in to the actual AIR once we're actually given access. The services, health professionals, we've just completed all of that. All right, so there are two different access options for aged care facility staff. The first one is if you were a delegate. So if perhaps there's a doctor that visits the facility or um, a nurse practitioner, either or may well ask you if you would like to be a delegate so you can access the AIR on their behalf. You would give them that RA number we just created, and then they would make you a delegate under their logon through PRODA. Okay, so you still log on through your own individual, but when you log in, you would select to act on behalf of the doctor or the nurse practitioner. The other way, of course, is if your organisation is sends in the IM004 form to register as an AIR provider, and they then create a PRODA account and add you to that PRODA organisation, and then you'll be able to log on to the AIR for your organization. And you can have both. You could be a delegate for nurses, a nurse practitioner at your facility, and you can have access to the organization as well. You make the choice when you log on to which way you're going to log on. I'm going to show you that when we move forward a little bit. So here we are. So we've got the option when we go to HPOS to either go as a no organization and proceed as an individual. So that is where you would be a delegate. Or if you are obviously a health professional yourself, you would choose that as well because you've got an entitlement to AIR anyway. You don't need to act on behalf of an organisation. If your access to the AIR is on behalf of your facility, you would choose the AIR residential care facility there. That's what we've got, but obviously that would be your name and you would continue. Then you come in to the into HPOS and you'll see the My Programs tile, and behind it you'll find the Australian Immunisation Register. Now, if you don't have that, when you click on, you will need to just check with your facility manager perhaps that they have actually given you the attribute so that you can access the AIR. And then once you log on, you'll be asked for your HPIO number, which is the healthcare provider identifier field for your organisation. You may not know that, and you don't have to input it. By all means, if you do, please input. If not, just click next. And then again, as you saw earlier, is the welcome page to the AIR. And now we are going to go back, and I will share my screen again. Once I have logged in, I just have to log in, this time as someone who does have access to the AIR. So I am good to go now. All right. So we're just going to log in. Because this identity has been added as a delegate. So we're logging in. We always get our code either via email or if you've chosen mobile, and that was just the email arriving with my code. Next. All right, so what I want to do is I want to go to HPOS because it's in Health Professional Online Services where I'm going to find the AIR site. Right, now you can see in our test case got a lot of options here, but the one that I need to use because in order to show you the AIR site is no organisation, proceed as an individual. Okay, now just noting here, this banner message relates to all different programs that Services Australia has. They're not specific to you. They may be about some things that are important to you, so always give them a look. But as you can see, it's about PBS. It's probably not information that you need to know. If we were sending you a message that was definitely for you, it will be down here on the messages token icon, which is what we call HPOS messages. Okay. So now, as Anastasia Cusack, if I go to my programs, I don't find the AIR. And that's because Anastasia Cusack herself doesn't have any access to the AIR as an individual. I need to either be acting on as a provider, which you will find over here on the right-hand side so that you can act on your providers, or if I'd chosen to log on as part of an organisation, then I would have access. But for tonight's demonstration, I do have to choose a provider that I have delegation for. And you can see I've got two options there. We'll select this one. Being a test site, you always have that little bit of anxiety. It's going to, nope, it's brilliant. It's working. All right, so over here now I can see that I am now acting for Professor Cusack. And if I click back on my programs now, I find the one I want listed first, which is the Australian Immunisation Register. Now, you remember back on the presentation, we were asked about the HPI and the HPIO. We're going to just click next. And this is the welcome screen to the AIR. If you've not been here before, you will be asked terms and conditions. That's fine. Just say yes and away you go. I don't have that because obviously I've been here before. So in order to have a look at a person's immunisation history, or perhaps to record a vaccine that's been given, you click on the Identify Individual here on the left-hand side on the menu, and you have a few options on how to find the person. Best way, of course, is the Medicare number, and there's that IRN, the individual reference number on the card. You will need that. Can't just input a Medicare number, must have an IRN. If they aren't a person with Medicare and they've got an individual healthcare identifier, you can input that. And if they've got nothing and they're brand new and they've come into the facility, but they've got quite a bit of immunisation history, we would love for you to pop that onto the AIR for us. So you will create their record for them. All right. It's either or it's not all three. So we might just start actually with someone who's come in who maybe has come over as a self-funded retiree or something and doesn't have any entitlement to Medicare. But of course, we do want to record their details. So the important steps are surname, first name, and date of birth. Whenever you see the red asterisk, that is compulsory. So date of birth, you can key it in. I like to use a little calendar. Click on the year. We're going to go back. I'm going to go back. 1936 will do, August 13th. All right. And male. And you don't have to put a postcode range in, but you can if you like. And then search. All right, so up here it says the individual has not been found. Please check keying, correct any errors, include extra details. So you could obviously then pop in the postcode, etc. But we've had no joy, and we didn't expect to, because we know he's, arrived from wherever and he's brand new. So we're going to record the encounter anyway, because we do want to have his details. So we've now got up the top here, Ronald and the date of birth. We will want, in this instance, the actual address, because even though you haven't input a Medicare number or an IHI or anything, our system will search so that we can match him up if we did have a record for him. So please input the address. Okay, so now he's got a few more details up here, got his name and his address and his date of birth. So the first question you're asked is, who performed this immunisation encounter? So as I said, if it had come with a long list of immunisation history from overseas, you'd click on there and choose this encounter was performed overseas. If it come from interstate, somewhere else, or even just, in another suburb, it was another provider, you would choose that. Or if it was done at your facility, you would select I performed this encounter. And it doesn't mean necessarily you personally, it means whoever you're acting on behalf of. So it would be your organisation or the doctor. And then in this case, we need practice location. You probably won't be asked that question unless you are acting on behalf of a health professional, because your organisation only has the one AIR provider number. But in this case, we're acting as a doctor, so we have to choose our location. Obviously not performed at school. We're not going to put anything there. Date of service, again, I do like to use the calendar, so we'll just pop that in. And then we come down here and we start to input. So say, for example, he had, let's see, say he was given his flu shot, right, fluid quad. You saw how that popped up. Say it was something else like zoster. There it is down there. So you can see it just brings it up, tries to make it as easy for you so there's not too much keying. What was the vaccine type? We're going to say it's NIP Commonwealth because it was the zoster. Actually, no, he's not eligible, so we're going other. So these are the different options for your vaccines. Obviously, it's not going to be antenatal, NIP, or the option is other. And then the means by which it was actually given, and we add. So it's telling us here just to check our details. You get this chance here to check. And also you'll see over here, there's a little trash can. You can delete it. If that was totally wrong patient, wrong everything, you can only at this point delete. If you find out after you've submitted it, it's been deleted, you actually have to contact the AIR. You can't delete anything yourself. You can edit, and I'll show you that in a moment. That's what that is for. If it was actually the wrong vaccine or something, I could edit it, as long as it was still the same patient. Sorry, not patient, resident, and then submit. All right, success. That has been now lodged for Ronald. And as a general rule, if he wasn't a person that didn't have any identifiers, as in Medicare or an IHI, you would be able to see that, but you can see there's no immunisation history because he's a person that we're going to have to do an overnight check for. But for example, if we had someone else who did have a Medicare card, so we're popping in their number and their individual reference number, and we're going to have a look. So this is for Hermione. So we've got all her details. She's got a Medicare number. And look, oh, she is due. That's just to let us know that next year she's going to be due her zoster. So we've got that there. Due on the 19th of September next year. So that's what you can do with just their individual details and their Medicare number. Bring them up, have a look, see what's due, if there is going to be anything, and if there was immunisation history, you'd be able to see it down here now. Unfortunately, Hermione hasn't got anything, but that's okay. I have another person. Let's identify another person. Okay, and search. Right, this is for Horatio. Now, Horatio again has a Medicare number, which is great. He's not due anything. No vaccinations are due. And down here, if we come down here, we can have a look. And he's got some immunisation. Oh, he's got one. Better than nothing. All right, so he's got a booster. An ADT booster done on the 1st of October. Okay, so that's basically his full record. If he had more, we'd have pages. But just say, for example, you'd realised, he didn't have an ADT booster. He had a flu shot. Okay, so we want to see if we can fix that. 9 times out of 10, probably even 9.9, you should be able to update that. So you still bring up his records through individual, identify the individual. But you'll notice here, we've got on the menu on the left, update the encounter. Now, what that does is if there's anything on the gentleman's history that can be updated, you will see this edit pencil. So we click edit and we can change it. So what did I say? It was fluid quad. Okay, fluid quad, batch number, other, subcutaneous, and update. Okay, so now that shows you that he can actually, sorry, it doesn't show you what he can do. That shows you now we've changed that successfully and it's now showing the correct detail. So just a reminder again that you can edit encounters, but if it needs to be deleted because it was the wrong patient, the wrong resident, sorry, Medicare background, then you'll be able to update that information. So all roads start or lead from identify the individual. Must always identify the individual first, and then as you saw, you can actually look at their immunisation history, and you can record any immunisations that have been given or any historical ones as well. Okay, I will go back to the presentation now. Okay, thank you. That was brilliant. All right, so just common vaccination reporting errors that we just want to cover off as well, just quickly. When you recently, when we did this adult flu season for children, we discovered that there were children under 5 that had reported the adult flu. Probably not relevant to you, but 75% of those 1,000 were just incorrectly reported. Okay, so I don't know that you'll necessarily have software that's going to pre-populate the vaccine, but as you saw, they do run alphabetically. So if you do continually select the first one listed, you're always going to run into trouble because it necessarily would be that vaccine. And then there's the, naming conventions, fluid quad, very similar to flu quadri, booster X, etc. So just watch those, and always, as I said, be aware that you can edit via the update encounter. Sometimes, of course, wrong vaccine reported for certain age groups. There is the immunisation handbook, which will advise you of all of that. Then the incorrect individual reference number, IRN, name, or date of birth, all of that information will end up in a record that isn't accurate. So just, if you can, be careful. I mean, the fact that you can edit information is because people do make mistakes. We all do, but we all want to aim, obviously, for perfection. And don't resend anything to the air. Okay, do always check on the air, and perhaps contact us if you need to ensure that, if you've sent something through and you did receive that claim success, and yet it's not showing on the person's history, then contact us. Don't actually resend it. All right, and in our education resources, which I mentioned earlier, we do have an infographic, which you can see here. Again, walks you through how you can update a vaccination that has already been sent through, if, of course, it was your organisation. You can't update a record, of course, that wasn't sent via your own software or through the AIR site. Okay, I've just been told the slide is not moving. Oh, goodness, what's happened? Okay. All right, sorry. Let me just check. Something's just gone amiss. Just checking if you can see it now.
Yeah, we can see it, Michelle.
All right, brilliant. Sorry. Oh my goodness. Okay, that's all right. So I just was talking about how wrong naming conventions, wrong vaccines, incorrect IRNs, and don't resend vaccinations. There is that infographic there you can see in our education resources. So you can all go and have a look at that if you needed to actually update an encounter. And there's also the submitting information to the Australian Immunisation Register. There's a module that'll walk you through how to do that. And as we said before, no Medicare card is not a problem. You can actually register the person, and our system will do a check, but also will create a record if indeed we don't find that they've got a Medicare or an IHI. Will create a record for them. The HPOS messages, I only briefly touched on that, but that is something that you can use if you need to send us a secure message, because we don't obviously want people's individual emails, individual details coming through email. We need those to be secure. So if you use the HPOS, the message box, and send email, compose new email, it will let you choose the AIR. It's the first option in actual fact, so you don't need an email address. You pop in the details there. This person has got 2 records, for example, that need to be merged. So just pop all the details through, and we will get that fixed up for you. And what will happen is you will get an email back into HPOS messages to let you know that that has been successful. And then our education resources are here on the Services Australia website. You've got the Immunisation Register, you've got HPOS resources, you've got PRODA resources. And as I mentioned, there are the modules that you can do, the simulations, and the infographic cheat sheets, as we say, to help you out. And then there's just some contact details for you, the AIR at Services Australia, the General Inquiries line, and AIR Site Inquiries line. And also you're getting a copy, of course, well, you will have access to a copy of this, which has got the PRODA, if you had any problems when you're creating your PRODA account. Okay, thank you all. I know that was a lot of information to get through, so I hope, that it that was entertaining, or not entertaining, as informative for you. And I'm going to hand over now. So thank you very much.
Thank you so much, Michelle. You're a wealth of information. So I just wanted to just talk very, very briefly about the immunisation history statement. This is the paper version that most people will see. I just needed to remind you to, if you get one of these, just check your last date of your last vaccination, which will be at the bottom of the screen. The brand name of whatever vaccine it is that you're looking for is on the right-hand side. And as a reporting requirement of the Department of Health and Aged Care, WAFA contacts residential aged care homes on a regular basis to check on your COVID-19 vaccination rates for residents. So be on the lookout for those emails. And now I'd like to pass over to Ricardo, who's going to be speaking about My Health Record.
Hello, everyone. Thank you. I'm from the digital health team, and I will be talking about My Health Record in aged care, in particular, its benefit and the types of documents that are important for aged care. The caveat to all this information is that we are aware that aged care homes are having trouble connecting to My Health Record for several reasons, or just aren't there yet. That's okay. That's because there are software and compatibility issues with the vendors that the Australian Digital Health Agency are working tirelessly to help get over the line. And it could also be contingent on change processes at your head office level as well. So if there's going to be any major takeaway for tonight regarding My Health Record, is to have a conversation with your facility manager or your senior management about where your aged care home is with its pathway to being connected to My Health Record. So what is the record? It's a secure online summary of a patient's health information. Healthcare providers are involved in the care of a patient that they may access My Health Record to view and add patient health information. Patients can control which organisations and individual providers view it, and it's accessible at all times and protected by the interplay of several security and access systems. The My Health Record system grants health providers access to timely information about their patient's medical history, which can include medical conditions, medications, prescriptions, dispensings, pathology, allergies, immunisations, very importantly, and other views and summaries. This is it's a comprehensive list of a lot that you can get from My Health Record. And in this presentation, I'll only be honing in on a few of them. You will all get a copy of this presentation if you want to dig deeper, particularly with some of the links. For example, documents in My Health Record can be helpful with some clinical tasks and workflows in aged care. So if you need to reconcile a resident's medication, the My Health Record has a medicines information view. If a patient is being transferred, then the My Health Record offers discharge summaries from hospital or residential aged care transfer overviews. It offers pathology to avoid duplication of testing and advanced care planning documentation, which is a recent addition, and that helps to inform processes of end-of-life care decision-making. So if we take a step back to the broader benefit, the efficiency gained through the use of My Health Record by the health sector, its organisations and individuals are intended to lead to the overall improvement in patient outcomes. If a health professional has the right information at the right time through a system like My Health Record, particularly in the after-hours space, we can potentially reduce the need for the duplication of services, costly hospitalisations, if, say, a GP feels that they do not have the information that they need. Healthcare providers like GPs and registered nurses can view and upload to the record via their clinical software. Otherwise, My Health Record is view only through the online National Provider Portal, which is like a web view. Consumers can also view their My Health record. So your residents can view it through MyGov or using the Health app. They can also add information such as health notes and summaries through MyGov. And this is just a little depiction of what it might look like on the left through your clinical software and on the right through the National Provider Portal. Any clinician involved in a resident's care may view the health record if the viewing event is connected to providing healthcare. It cannot be accessed for any other purpose, and penalties do apply. And just to paint a picture of all the legislation regulations that underpin My Health record, there's a healthy list there. The document's very long and I'll save us the time, but you're welcome to investigate when you have the slide deck. The security of the health record is robust interplay of encryption and access services like PRODA that was discussed earlier, cybersecurity and monitoring, secure storage, and the conformance requirements that the clinical software vendors must abide by. The conformance process is a big reason why functionality can be mixed across software vendors, and this can affect how scattered access to My Health record is across aged care homes at the moment. There is a process on how to register and set up My Health record in your aged care home. Like I said, talk to your facility manager or higher management to determine where you are in that process. And importantly, in the aged care setting, we recognise that many residents will not be able to manage their records. So the system does allow for an authorised representative to do so for them. Residents, this will typically be a family member or a person that has been granted enduring power of guardianship. This is a process that only the family or of the resident can initially action. And so it's good practice to have the family of a resident consider this process, especially during a resident intake into aged care. A resident can also nominate a representative, which is a watered down kind of access feature. The resident still has a level of control, but the carer or nominated individual still has some access to support their My Health record access needs. So let's pause for a moment and consider the patient journey, more specifically Caleb, who has had a fall and recently been transferred to your aged care home. You can see there is an interplay of different health professionals external to your aged care home, and each has the capacity to add information to Caleb's health record. So GPs will upload several kinds of documents like health summaries, and pharmacists can upload dispensing events. Caleb's carer might potentially be his authorised representative with viewing access and also adding information. And then, of course, the registered nurse at your site can view and upload information as well, which can be viewed by external providers. So I'll talk about some of the documents that you might be able to view or access through My Health record. So discharge summaries provide information about the resident's hospital stay and recommendations for care after discharge. When a hospital is connected to the My Health record system, a copy of the discharge summary can be uploaded through the resident's My Health record, which allows residential aged care homes and healthcare workers to immediately access this vital information when their resident is returning. The Immunisation Consolidated View complements AIR. Any vaccination that has been reported to AIR will appear in this view. This view allows a provider to screen a resident's vaccination history together with a broader medical profile review outside of a vaccination clinic. And this may prompt the need for a vaccination. I'll reiterate, though, that any vaccination event is recorded on AIR by the provider. The provider does not use My Health record to upload or report a vaccination event. There is a recent enhancement allowing for the direct upload of these documents to a resident's My Health record, the Advanced Care Plan, or Goals of Care. An advantage of having these on the record is that a visiting GP will immediately have access to these from their offsite system and can review prior if they wish. This can complement a residential aged care home's processes regarding the storage and retention of aged care, advanced care plans. The medicines view can support resident intake processes and events where a resident is transferred to hospital or seeing a GP off-site and then returned to the aged care home, especially when their medication profile has been updated by an external clinician. Provided the external clinicians are uploading to the record, this information will be immediately available to aged care providers and their visiting GPs. Pathology reports are uploaded by registered pathology laboratories. Reports are immediately available to all members of the patient's healthcare team through My Health Record. Major pathology labs across WA that are connected and uploading include PathWest, Clinipath, and Western Diagnostics. Some of the reports that are available as soon as they are uploaded can include reports about COVID-19, international normalized ratio, HbA1c, and respiratory infection tests such as flu, just to name a few. These being available creates efficiency gains in the communication of pathology information to the healthcare team. One of the newest developments is the aged care transfer summary, which is a digital solution using My Health Record that facilitates access to crucial health information relating to an aged care resident to support clinical handover. It also includes some new record fields, such as a residential care transfer reason, residential care medication chart, and care health summaries. It will also pull and present data from reports added by the healthcare team more broadly into this format. And then we have the shared health summary, which is a snapshot of a resident's health in time, and it can include medical conditions, medicines, allergies, and adverse reactions and immunizations. It's uploaded by a nominated healthcare professional, such as a GP or registered nurse. Event summaries capture health information about a significant healthcare event that is relevant to the ongoing care of an individual. It may be used to indicate a clinical intervention improvement in a condition or that a treatment has been started or completed. Event summaries can contain allergies, medicines, diagnosis, interventions, and their primary intent is for healthcare providers who are not the patient's regular provider to record such a situation and upload it to the record. So there we have it, with resources and further information that can be provided by the ADHI via online training modules. The access to these training modules is free, but there is a registration process, which is really easy. And you'll also be provided with one of these flyers about the residential aged care fact sheet post this session as well. And there's also ongoing support provided by the ADHA. Simply email them if you're needing assistance with use of the My Health Record or registration to Health Record as well. And some more information there that you can access. And just one more project is that the WA Primary Health Alliance has undertaken work to provide support to residential aged care homes with enhancing their out-of-hours action planning. There is now a suite of resources that have been developed to assist aged care homes in self-auditing and improving the quality and sustainability of after-hours care to their residents. So please feel free to have a look at these resources. And if you need extra support in this space, please feel free to contact me. And there we have it.